Your breath right now could be trying to warn you about something happening deep inside your body. And what I'm about to show you in the next 15 minutes might be the wake-up call that changes everything. I'm Dr. Ethan Miles, 25 years as a dentist specializing in senior health. And here's what nobody tells you about bad breath after 55. It's not just embarrassing, it can be your body's emergency alarm system going off. Did you know that nearly half of all adults deal with chronic bad breath? But here's the shocking part. Up to much a 40% more of those cases are actually signaling a serious underlying health condition that has nothing to do with their teeth. Heart disease, diabetes, kidney failure, even certain cancers. Your breath becomes the messenger. So if you've been covering your mouth when you talk, avoiding close conversations with your grandchildren, or reaching for mints every hour, this isn't about vanity. This is about your survival. Because what you smell on your breath today could save your life tomorrow. Let me be very direct with you. Your mouth is not separate from the rest of your body. The blood vessels in your gums connect straight to your heart. The bacteria on your tongue can travel to your lungs. The dryness of your mouth reflects what's happening with your medications and your organs. Everything is connected. And that means when something smells wrong, something is wrong. Now, before you start panicking, let me walk you through exactly what different types of bad breath mean, when you should be concerned, and what specific actions you need to take. Because knowledge removes fear, and action saves lives. Not all bad breath is dangerous. Let's start there. Morning breath? Completely normal. Your mouth produces less saliva while you sleep. Bacteria multiply, you get that unpleasant smell. Brush your teeth, drink water, it disappears. Not a concern. Food-related breath from garlic, onions, coffee? Also normal. Those compounds get absorbed into your bloodstream and come out through your lungs when you exhale. Temporary, not dangerous. But here's where we need to pay close attention. Persistent bad breath that doesn't go away after brushing. Breath that has a distinctive smell. Sweet, chemical, ammonia-like, fecal. These are the ones that should make you take action immediately. Let me break down what specific smells mean because this could literally save your life. Sweet or fruity. Breath that smells almost like nail polish remover. This is a red flag for uncontrolled diabetes. When your body can't process sugar properly, it starts burning fat for energy instead. This produces chemicals called ketones. These ketones have that distinctive sweet smell. If you notice this, especially combined with excessive thirst, frequent urination, or unusual fatigue, you need to see a doctor within 24 hours. This could be diabetic ketoacidosis. It's a medical emergency. Ammonia. Breath, that sharp chemical smell like cleaning products or urine. This signals potential kidney problems. Your kidneys filter waste products from your blood. When they're not working properly, urea builds up and gets released through your breath. This is especially critical if you have high blood pressure, diabetes, or a family history of kidney disease. Your kidneys could be failing, and this is one of the first warning signs. Sour breath, like stomach acid. This usually indicates acid reflux or GERD. Stomach acid regularly coming up into your esophagus and mouth creates that distinctive sour smell. Many people over 55 have this without even realizing it. They might just feel occasional heartburn or have a persistent cough, but that acid is damaging your tooth enamel and could be eroding your esophagus. Left untreated, chronic acid reflux significantly increases your risk of esophageal cancer. Fecal breath, that rotting smell? This is serious. It can indicate a bowel obstruction, severe constipation, or in some cases, cancer in the digestive system. This smell means waste products that should be leaving your body are backing up and being absorbed into your bloodstream. You need medical evaluation immediately. Now, the most common cause of persistent bad breath in adults over 55 is actually right there in your mouth. Gum disease. Periodontal disease affects nearly 70% out of adults over 65. And this is where things get really serious. When bacteria accumulate along your gum line, they cause inflammation. your immune system responds. This chronic inflammation destroys the tissue and bone holding your teeth in place. Pockets form between your gums and teeth. These pockets fill with bacteria, food debris, and dead tissue. All of this creates a powerful smell. But here's what most people don't understand. That inflammation doesn't stay in your mouth. The bacteria and inflammatory chemicals enter your bloodstream. They travel throughout your entire body. Research has proven clear connections between gum disease and heart attack, stroke, uncontrolled diabetes, respiratory infections, and even Alzheimer's disease. The bacteria from infected gums can attach to the walls of your arteries, contributing to plaque buildup and increasing your heart attack risk. They can travel to your brain, potentially contributing to cognitive decline. They can be breathed into your lungs, causing pneumonia. So when we're talking about bad breath from gum disease, we're not just talking about social embarrassment. We're talking about life-threatening conditions. How do you know if you have gum disease? Your gums bleed mine. When you brush or floss, they're red, swollen, or tender. They're pulling away from your teeth, making your teeth look longer. You have persistent bad breath or a bad taste. Your teeth feel loose or are shifting. You see pus between your teeth and gums. If you have any of these signs, you need to see a dentist within the next 2 weeks. Not next month. Not when you get around to it. Soon. Because gum disease progresses. It gets worse. And the damage it causes to your heart, your brain, your entire body accumulates over time. Let me talk about something that affects almost every person over 55 who walks into my office. Dry mouth. And this is absolutely critical for understanding bad breath. Saliva is your mouth's defense system. It washes away food particles. It neutralizes acids. It has antibacterial properties that control bacterial populations. When you don't have enough saliva, all of these protective functions fail. Bacteria multiply rapidly. Food sticks everywhere. Acids damage your enamel. The result? Cavities, gum disease, infections, and terrible breath. Why do older adults have dry mouth? The number one reason is medications. If you take multiple prescriptions, and most adults over 65 take at least 4 medications, chances are high that at least one causes dry mouth. Blood pressure drugs, antidepressants, antihistamines, pain medications, bladder control drugs, anxiety medications. The list is extensive. Other causes include diabetes, autoimmune conditions, cancer treatments, breathing through your mouth at night, and natural aging effects. Here's what you need to know about dry mouth. First, talk to your doctor about your medications. Sometimes doses can be adjusted or alternatives tried. Don't just accept dry mouth as inevitable. Second, stay hydrated. This is not optional. Sip water throughout the entire day. Not coffee, not soda. Water. Keep a bottle with you. Small sips frequently. Third, stimulate saliva. Sugar-free gum with xylitol helps. Crunchy fruits and vegetables like apples and carrots increase saliva flow. Fourth, avoid alcohol-based mouthwashes. They dry your mouth further and make breath worse long-term. Fifth, use a humidifier at night. This prevents your mouth from completely drying out while you sleep. I've seen patients whose entire quality of life transformed just by addressing dry mouth. The bad breath disappeared. The constant mouth pain stopped. They stopped getting cavities, all because we identified and treated the root cause. Now let's talk about dentures because this is relevant for many of you. Dentures are porous. They absorb bacteria, food particles, and saliva. If you don't clean them properly every single day, bacteria colonize the surface and multiply, producing foul odors. Here's what you must do. Remove dentures every night. Brush them daily with a denture brush and denture cleaner, not regular toothpaste. Soak them overnight in a denture cleaning solution. Rinse thoroughly before putting them back in. Brush your gums, tongue, and any remaining teeth every morning and night. Also critical, see your dentist regularly to check denture fit. Your jawbone changes shape as you age. Dentures that fit perfectly 5 years ago might be loose now. Poorly fitting dentures cause bad breath, pain, difficulty eating, and serious infections. Let me address something many people don't connect to bad breath. Sleep apnea. When you stop breathing repeatedly throughout the night, your body gasps for air by opening your mouth. You mouth breathe all night. This completely dries out your mouth. Saliva evaporates. Bacteria multiply explosively. You wake with terrible breath and a sticky, dry mouth. If you snore loudly, wake up gasping, feel tired all day, or your partner says you stop breathing at night, you need evaluation for sleep apnea. Not just for bad breath, but because untreated sleep apnea dramatically increases your risk of heart attack, stroke, and sudden death during sleep. Treating sleep apnea improves breath and can add years to your life. Patients tell me they feel decades younger once properly treated. Sinus issues also cause bad breath that dental care can't fix. Chronic sinusitis creates thick mucus that drips down your throat, coating your tongue with bacteria and debris. That's why you can brush perfectly and still have bad breath if you have postnasal drip. If you have frequent throat clearing, persistent cough, feeling of something stuck in your throat, or bad taste, see your doctor. Treating your sinuses will improve your breath. Now, let me give you the specific red flags that should send you to a healthcare provider immediately. Red flag. Your breath doesn't improve with good oral hygiene. If you're brushing twice daily, flossing, using mouthwash, staying hydrated, and your breath still smells bad within an hour or two, the source is not in your mouth. Red flag 2. Your breath has a distinctive chemical, sweet, ammonia, or fecal quality. These specific smells often indicate systemic disease. Red flag 3. Bad breath is accompanied by other symptoms: fatigue, weight loss, fever, persistent cough, difficulty swallowing, chronic heartburn, excessive thirst, changes in urination. Your body rarely gives just one warning sign. Red flag 4. The bad breath came on suddenly or changed suddenly. If you've always had mild breath issues and suddenly it's much worse or smells different, something in your body has changed. Investigate it. Red flag 5. You have existing health conditions. If you have diabetes, kidney disease, liver disease, respiratory problems, or gastrointestinal issues and you develop new bad breath, your condition may be worsening. Here's exactly what you should do if you have persistent bad breath. Step 1. Improve your oral hygiene for 2 weeks. Brush twice daily for 2 full minutes. Use fluoride toothpaste and a soft brush. Floss every single day. Brush your tongue. Drink plenty of water. Avoid tobacco and limit alcohol. See if this resolves the problem. Step 2. If breath doesn't improve after 2 weeks of excellent hygiene, see your dentist. Get a thorough examination. Be completely honest about your concerns. A good dentist will examine your entire mouth and ask about your overall health, medications, and other symptoms. Step 3. If your dentist says your mouth is healthy or treating dental issues doesn't resolve the breath problem, see your primary care doctor. Tell them about the bad breath. Describe the smell precisely. Mention every other symptom, even if it seems unrelated. Your doctor can order appropriate tests. Step 4. Be persistent. Finding the cause sometimes requires detective work, blood tests, imaging, specialist referrals. Don't give up. Keep advocating for yourself until you get answers. Let me give you practical tips for managing breath while investigating the cause. Stay hydrated constantly. Water is essential. Clean your mouth after meals, at least rinse vigorously. Chew sugar-free gum with xylitol. Eat crunchy fresh foods that clean your mouth naturally. Consider oral probiotics. Avoid alcohol-based products. See your dentist every 6 months, more if you have gum disease. Keep a food and symptom diary. Write down what you eat, how your breath is, other symptoms you notice. Patterns might emerge that identify triggers or causes, and manage your overall health comprehensively. Control blood sugar if diabetic. Take blood pressure medications consistently. Maintain healthy weight. Don't smoke. Limit alcohol. Exercise regularly. Manage stress. All of these affect your oral health and your breath. You know what strikes me most after 25 years in practice? How interconnected everything is. You cannot separate oral health from physical health. You cannot separate physical health from mental and emotional well-being. It's all one integrated system. When we identify and fix the cause of bad breath, whether it's gum disease or a systemic condition, the transformation is remarkable. People smile freely again. They laugh without covering their mouths. They engage confidently with others. That's not just about breath. That's about quality of life. And for those of us in the second half of life, quality of life is everything. We want to enjoy grandchildren, travel, pursue passions, spend time with friends. We don't want embarrassment or preventable health problems holding us back. Here are your 3 key takeaways. First, bad breath is common but not normal. If you have persistent bad breath despite good oral hygiene, there's a reason. That reason can and should be identified. Second, bad breath is not just social. It can be a critical window into your overall health. Different smells indicate different conditions. Pay attention to what your body is communicating. Third, you have the power to address this. See your dentist, see your doctor, be your own health advocate. Ask questions. Insist on thorough evaluations. Don't accept vague reassurances if you know something is wrong. Trust your instincts. Your health is precious. Your comfort and confidence matter. You deserve healthcare providers who take your concerns seriously and work with you to find real solutions. If you found this information valuable, I encourage you to subscribe to Smiles Over 60. I'm here to provide practical, evidence-based health information specifically for adults over 55. We explore teeth, gums, overall health, and the critical connections between them, because staying healthy and vibrant in our later years is absolutely possible with the right information and the right actions. I genuinely value hearing from you in the comments. Have you dealt with persistent bad breath? What was the underlying cause? What strategies helped? Your experience might be exactly what someone else desperately needs to hear right now. Take care of yourself. Listen carefully to your body. And remember, your breath is always trying to tell you something important. The only question is, are you paying attention? Thank you for spending these 15 minutes with me. Stay healthy, stay informed, stay confident, and I'll see you in the next video. The core. Truth. Your breath is not merely about fresh mint and social confidence. It's a biological messenger carrying vital information about your body's internal health status. When you pay serious attention to persistent bad breath and systematically investigate its underlying cause, you're not being overly concerned or vain. You're practicing intelligent preventive medicine. You're listening to your body's sophisticated early warning system. And you're giving yourself the optimal chance to catch and treat problems while they're still manageable. At this stage of life, that awareness and decisive action can literally add quality years to your life and vibrant life to your remaining years.